In the meantime, we want to get to another topic that is front and center in Washington, D.C., and that's health care reform. The latest development, the director of the Congressional Budget Office says the current proposals to overhaul health care will not effectively curb spending over time. So how much do these comments change what happens in D.C.? We bring in right now Professor Jacob Hacker. He is with us. He is the Stanley Risser Professor of Political Science at Yale University. He is also credited as being one of the architects of the so-called public option. Professor, always glad to have you with us. Just to play devil's advocate, because you know we have to, we already have a public plan. I mean, if you like, a sort of test bubble in a way, right? I mean, Medicare is a public plan, and its critics would say not very good at containing costs. So what makes you think it's a good idea to expand a public option?
Well, we do have a public plan, Medicare, that's actually very popular with senior citizens and the disabled, and which has done a relatively good job, actually, at containing costs relative to private insurance over time, especially when you consider that it's done that cost containment while maintaining broad access for seniors. But this new public plan that would be available to people younger than 65 that's being talked about in Washington, and just to be clear, it'd only be available to people who don't have coverage through their place of work, wouldn't be exactly Medicare. It would have more ability to innovate, to focus on providing value, to contract directly with providers. And I think that's what has to happen with Medicare over time. Everyone's talking about bending the curve using Medicare, and what I've been arguing is that we should be using Medicare and this new public plan to improve the delivery and quality of care.
What about the idea that Medicare seems to be more successful at paying for things like imaging, specialization, and less for primary care and prevention, with many people in the healthcare system saying it's the primary care that really keeps people from getting more sick?
It's absolutely the case. You know, it's partly because of lobbying of Medicare. It's partly because that's the way our system has been skewed by private plans as well. But I think that everyone agrees that Medicare should be paying primary care doctors more relative to specialists and advanced imaging and other things like that. This is a problem with our system, right, that we have a real imbalance in rewards for the kind of basic preventive and primary care that we know keeps people out of the hospital, that we know keeps people healthy and keeps costs down as a result. So that's going to have to be part of the agenda. And if you look at what the House of Representatives has put forth, what the Democratic leaders of the three major committees in the House have put forth, that's a really big part of what they're arguing for, a much greater emphasis on primary and preventive care. And I think the new public plan is a big part of that, because it's going to make sure people have good continuous coverage. It's going to also bring competition to the insurance market so that private insurers are pressed to do the same.
We spend about 17% of GDP right now on health care. With a public plan, what would be the goal as far as percentage of GDP spent?
Well, I think the real goal is to make sure that Americans have access to affordable quality care. We have to slow
But cost is an issue.
Oh, absolutely. We have to slow. Affordable is the first thing I said. You know, we have to slow the growth in health care costs. All of the studies that have been done suggest that a public plan could deliver good coverage for less than private insurance, and by competing with private insurance will also press private insurance to do a better job in bringing down costs. You know, my view is that when the CBO director said that the proposal from the Senate Help Committee didn't bend the cost curve, that he was responding to the fact that there's just not enough in this legislation to really give the new public plan and Medicare the authority to do the kinds of things we know need to be done to bring costs down over time. So my argument would be strongly that we need to make sure that we have a new public plan and Medicare with authority to do the things that will help control costs, because then private insurers that are competing with that new public plan will also be encouraging value rather than just paying for claims or trying to weed out sick people.
Professor Hacker, we thank you so much for your time. Professor Hacker there from Yale University.